city dwellers can now add pediatrician to a growing list of on-demand services. Healthcare startup Baby Doctor connects doctors with Manhattan parents and facilitates house calls at the click of a button. Joining us right now is Shahar Golan and Danya Rumbeck. They are the co-founders of Baby Doctor. And folks, welcome to both of you.
Thank you.
So I had a sick child at home last night while I was reading these notes, thinking this would be a great idea. The idea of being able to hit a button and have a doctor come to your house. How does it work?
Yeah, so it really works just like where you just push a button on babydoctor.com or app, and a pediatric professional comes right to the parent's door in 60 minutes or less. So it really kind of brings back that 1950s house call medicine of the pediatrician coming to your home and now adding our high-tech, high-touch app through babydoctor.com.
Danya, why would doctors do this? Because I think about it, it's great perspective, great from my perspective, but why in the world would a pediatrician agree to drive to my house and come meet me rather than book 4 or 5 patients an hour and knock it off?
So as per the U.S. Bureau of Labor Statistics, the median salary for a pediatrician in New York State is only $72 an hour.
That's kind of shocking.
So, yes, so we pay well above market rate for the pediatricians. Also, it gives them the opportunity to engage with patients in their homes and to really have a prolonged, helpful visit with the patient in their environment.
How much does it cost me?
So currently we have a flat price of $200, but currently we have a promotion that the first visit is $40.
But insurance, for the most part, has not really teamed up with this idea yet, so you are going to be paying out of pocket if you do this?
You will. We provide the parent with an itemized receipt that they can submit for out-of-network reimbursement. And we're fortunate that we have as investors the CFO of Anthem, the past chief medical officer of Anthem. And, you know, what you find is that, you know, the average cost of an ER visit is over $1,500.
Oh, my gosh.
And 2/3 of ER visits are non-emergency anyway. So you have parents visiting the emergency room unnecessarily for an ear infection or a tummy ache when they really could use our house call service. So we really feel that if it's to be covered and networked by insurance, it's a win-win-win for everyone, for the insurance carriers that can save money, for both the parents that can save both time and money, and obviously for the sick kids and now get pediatric care to their door in 60 minutes or less.
So how many doctors do you have right now? And it's just in Manhattan at this moment?
Yes. So currently we have over 50 providers. So either pediatricians, pediatric nurse practitioners, or family nurse practitioners that are in our network total.
I'm not guaranteed.
You're not guaranteed. You're not guaranteed a doctor. You are guaranteed. All of our providers are board certified, vetted, either pediatricians or pediatric nurse practitioners with many years of experience. As well as we do 4 background checks on all of our providers and an in-person interview. And so we have over 50 in our network, 30 that provide services in Manhattan. Currently, we are only in Manhattan, but we're looking to expand beyond Manhattan.
Expand where and when? What's the timing for this?
So our goal is to expand it to Brooklyn, Queens, the Bronx by end of this year, and then hopefully take it to New Jersey, northern New Jersey as well. So we're doing pediatric urgent care now. And in addition, the other service line we have is circumcisions, which we do in the greater New York area and northern New Jersey. So whether it be to your home, synagogue, or church, we'll also do a circumcision wherever you need that service.
Wow. What's the holdup in terms of what's the biggest hurdle you have to overcome in terms of expanding? Is it having money to expand? Is it convincing doctors to sign up? Is it convincing insurance companies? What's the biggest thing you have to conquer before you can really expand?
We have the doctors for northern New Jersey already, and we have many doctors in Brooklyn and Queens. I would say the holdup is really just the overhead, providing doctor kits for all the doctors.
What happens when someone calls from a family that can't afford it, and so will you end up with the same compassionate care problems not problems, but no one gets turned away from the emergency room, obviously. So if someone can't afford it, says, no, I can't pay that. Do you say then call the ER, we're not coming?
Well, I think that's where our first visit's a $40 promotion that really allows people to try it once.
A week later, 2 weeks later, it comes back and the kid is sick as hell, and the mother is like really worried and calls them and says, I need you, but I don't have $200. You going to go?
So I think the way we would look at it is that, you pay for it on credit card, which obviously you can pay over an installment plan. I mean, our goal is really to give parents on-demand access to pediatric care. Now, there is a service fee for doing such a thing, but we find that by giving people that maybe can't afford health insurance an opportunity to have a house call, they can pay for it with a credit card.
Although, to Joe's point, this brings up the weakness in the hospital system right now, is they have to treat everybody who comes in the door. If you guys cherry pick the people who have the money off the top, it leaves that system.
And you guys might end up
more.
saying no to people, and that's going to be hard for you to do. For compassionate, as doctors, it's like antithetical to the Hippocratic Oath, right?
Yes, I mean, it's obviously, there is a charge for medical care. As always, there's a charge for everything. But we find that by giving people an opportunity to try it where it's $40 and they can pay for it on credit card. We have a community give back program where we do free talks in pediatric healthcare that we're doing with local schools, community organizations, religious institutions. So even if it's not maybe necessarily a house call, Donya's leading these free pediatric health talks in our community. That's just a way to give back to the community and promote education to parents of, trendy topics, Zika, back to school health. How can parents learn more about caring for their kids to promote happy, healthy kids, which is our mission?